Hello and welcome. It's 11 a.m. here in Seoul. I'm Lee Kyung-eun at the Arirang News Center. We're breaking into our regular session to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Health Ministry official Yoon Tae-ho will be giving us details on the COVID-19 situation here in the country. He'll fill us on the number of new infections as of midnight and the efforts that the government is making to contain the virus, especially with continuing cluster infections here in Seoul and the surrounding capital region. To give you a brief idea as we wait, South Korea reported 562 new cases on Wednesday. We'll cut into the briefing. Take a listen.
Let us now begin our regular briefing for January 13th, Wednesday. As of today midnight, we have a total of 536 new local infections and 26 new imported cases. Yesterday at the makeshift testing center, we have identified a total of 110 people. And yesterday we had 20 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Starting from the 7th of January until the 13th, we have seen 593 cases on a daily average, and this is a slight decrease from the some 800 from the previous week. And we have about 400 to 500 cases in the metropolitan area. And also we have seen a decline in these cases as well, and in the metropolitan area as well. And we have seen a decrease in the proportion of cluster infections. However, we have seen about 40% of those confirmed cases who were the previous contacts to previously confirmed cases. And we have also identified that the virus is spreading fast among personal gatherings as well as events. And as for cluster events in November, we have seen frequent cluster infections stemming from indoor sports facilities and cram schools and saunas. However, we are seeing a different trend right now stemming from religious facilities and nursing hospitals. And because there are many local infections and local transmissions of the virus, we ask you to refrain from going to social gatherings. And during the past week, we also have seen a decline, a continued decline from November in the movement of people in the metropolitan area. However, in the previous weekend, we have seen about 4% upward trend of such movement of traffic. And however, we would like to note that we would like to extend our deepest appreciation to the members of the public for your participation in social quarantine measures. And we ask you to continue to have vigilance, as we cannot let our guards down as of yet. And as for the vaccinations and therapy, we are we will be rolling them out in February, and until then we need to make a stable outbreak. If we do have a steady decline of our outbreak, we can also cautiously ease our restrictions on businesses which are going through many difficulties in terms of economically. So we ask you to comply with these social distancing measures. And also until this weekend, please refrain from going to social gatherings and also minimize physical gatherings as well. And as for the quarantine measures in the weekend as well as during these cold winter days, we have seen a decline in the number of cases of testings. However, we have seen a rebound in the number of tests lately, and yesterday we have seen over 58,000 tests being conducted with suspected symptoms, and about 33,000 cases were conducted at the makeshift testing centers in the metropolitan area. We thank you once again for your efforts. So if you have any suspected symptoms, we also urge that you need to get tested by visiting these testing sites. And as for the medical response, we have some updates. And in the after the 3rd of January until today, we have also 0 patients who are waiting to be admitted to the hospitals. And as for the intensive care beds, we also have more sufficient room as well. And we also have 11 hospitals that have been designated to treat critically ill patients. And nationwide, we have 256 critically ill hospital beds in the nationwide, as well as 110 intensive care units in the metropolitan area that can be utilized immediately. And as for the light treatment patients, we also have a total of 13,000 beds nationwide, and these include those in the life treatment centers. And we believe that the current situation enables us to respond sufficiently, even though we have about 1,000 cases on a daily basis. And we also have mobilized more medical staff members, including 200 medical doctors, as well as 1,300 nurses, and they have been mobilized to screening clinics as well as life treatment centers. And we also have further measures to contain the virus at correctional facilities. Lately, in the Dongbu Detention Center, we have had a total of 1,117 cases. And also nationwide, we have 2,000 cases of COVID-19 breaking out at correctional facilities. And we would like to note that at these correctional facilities, these are the places that are vulnerable to the virus because they share room together. And especially in the Dongbu Detention Center, we have seen that these detention centers were overcrowded by about 117%. And also at these detention centers, they had elevators which were used by many people, and they also had poor ventilation. And within these facilities, there were not enough room to have isolated places and locations to isolate these COVID-19 patients. To this end, the Ministry of Justice has provided some guidelines. First of all, as for the new inmates, they will be tested with the swift antigen testings, and also they will be looking at these isolated cases for 2 to 3 weeks. And before they are isolated from self-quarantine, they will get the PCR testing once again. On a regular basis, we will also be conducting the PCR testing on all of the staff who are working there as well, and we will also be providing a face mask to the people who are staying at these detention centers. And by institution, we would also have an isolation facility and also have a response scheme to transport these patients to necessary hospitals. And we will also provide a launch an emergency COVID-19 response team within these correctional facilities so that it can work as a control tower. And if one COVID-19 patient is detected, we will also make sure that this person is isolated from the rest of the public as soon as possible. And we will also put efforts to avoid 3C situations, and we will also enable more ventilations and also decrease the level of crowdedness. And we will also decrease these crowdedness by having special pardons as well. And for the long-term period, we also will increase the floor area for each inmate. And based on such detailed guidelines going forward, we will be containing and preventing any massive outbreak stemming from these correctional facilities. And as for the adjustment of the social distancing measures, we have been putting in place the gathering ban on many business operations. And also after we have elevated the social distancing measures in December, we have also conducted about 430 people who have been investigated for the breach of such measures. And as a representative case, we also seen many business operations which have been illegally operating by selling alcohol beverages as well as engaging in nightlife entertainment businesses as well. And we also have seen breaches of these measures by religious facilities as well. And we would like to highlight that breaching such measures is something that threatens the safety and the health of the public, and we will also take stern legal measures against any breaches going forward. We are seeing a downturn of the outbreak. However, this downturn trend is very slow, and we only have seen the downward trend persist for the past 2 weeks. So we ask you to stay vigilant going forward. And we need to make sure that this third wave does not rebound, and this is the time that we have to exert more efforts going forward. We need to also continue to exert our full efforts to comply with social distancing measures and also decrease the total tallies until January 17th and especially before Lunar New Year as well. We ask for your participation. So please minimize social and physical contact with others, and also keep social distancing and wear your face mask on a regular basis. And also, if you do not feel well, please get tested and stay at home. So these considerations and understanding for each other, we need to keep a physical distance. However, we need to stay close mentally. So, and the government will also exert our full efforts to increase our level of vigilance. Thank you very much.
네, 지금부터 질의응답 시간을 가지겠습니다. 배석자분께서.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 562 new cases on Wednesday. That keeps the daily tally below 700 for nearly a week. Of the new cases, 536 were locally transmitted and 26 from overseas. There were 20 more deaths, bringing the death toll to 1,185. South Korea's total number of cases has now broken the 70,000 mark. We'll wrap up the coverage here. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.